Okay, so I'm walking into my very first Pediatric Clinical rotation in my Nurse Practitioner program. To say I'm excited is an absolute understatement. I'm actually going to be spending my clinical rotation with the Nurse Practitioner that my children see, which is so exciting. And I've had my paperwork turned in for this clinical rotation for almost a year. So yeah, I'm so excited for this experience. I'll be making a day of a life video here. Obviously, that's what it's called when you click on it. And yeah, let's get this day started. Okay, so it's time to give you an update on my very first day in my Pediatric Nurse Practitioner Clinical. Today was a really good day. It's actually still raining, and it was raining when I came in this morning as well. Yeah, so let's talk. Today I was able to see several well checks and hear the vaccination spiel and which vaccines they get at which age. And there's actually a mnemonic to be able to remember that. So I am going to put a free printable below this video for you guys to grab that so that you can learn that as well. And then we had one patient who was diagnosed with ADHD. And so I learned about the Vanderbilt screening and how that whole process works. So that was really interesting. So which criteria do they have to have in order to get that specific diagnosis? And then once a person has been diagnosed with ADHD, how do you choose the treatment? So again, that was a very interesting thing to be able to be a part of. The patient was a 10-year-old male. He had been having tons of trouble concentrating. He failed the 5th grade. Yeah, really it was mostly a concentration and a fidgeting issue. So the Vanderbilt assessment is a series of questions. The first 9 questions focus on the ability or inability to concentrate. And then there are some questions that focus on oppositional defiant disorder. And then questions on the paperwork about anxiety and depression symptoms, which he was not exhibiting. So yeah, it was really interesting to see that be treated in the pediatric office and not automatically have to go to behavioral health. I think that's nice for continuity of care for parents and children to be able to work with a provider that they know and trust. So that was really amazing. And then we had one kind of, I guess maybe you could say, interesting situation. A patient who had bilateral shoulder pain, and there had been no activity changes, no injury, absolutely nothing new. And it was more just in one specific area. And it was only when the patient, who was 14, he was a male, extended his arm out. So no pain going backwards, no pain going forwards, only a lateral movement outwards. So we're just prescribing Motrin 3 times a day with meals, rest, either ice or heat, whatever feels better, and then waiting like 5 to 7 days and then reassessing. If he's continuing to have problems, then she's going to make a referral to specialist and potentially to have some therapy done. I'm thinking she's along the thought process that it's more of like a bursitis type situation, and she thinks that although he doesn't know what he did, that in fact maybe he did something to actually cause that damage, because it is on bilateral shoulders. It's slightly worse on the right side. So that was kind of nice to see her walk through that process. We treated 2 acute otitis medias today, and that was interesting. A patient was in urgent care yesterday and was given Zithromax for just an upper respiratory infection. Mom came and brought baby in today, 1.5 years old, and she was diagnosed with bilateral acute otitis media, and I guess it was pretty significant. So we discontinued the Zithromax and started her on amoxicillin, which is first-line treatment for ear infections. And She just had a really, really nasty cough. So it's just really interesting in the pediatric setting to be able to see, you know, this is what we look at, and if we see this, we do this, if we see that, we do that, you know, kind of situation. And it's just always very interesting in the new settings. So I am kind of tracking my nurse practitioner clinical rotations via these videos. So go ahead and subscribe to the channel if you're interested in videos like this. I am going to be a family nurse practitioner. I finish my education, my program, in October of 2021. So depending upon when you're watching this video, you're either coming alongside me for the journey, or maybe I've already passed my boards. So hey, future Amanda, good job on passing your boards. Staying optimistic. Yeah, so that is that. It was a pretty phenomenal day. Yeah, so I'm gonna go ahead and wrap this vlog up. I will be posting another pediatric nurse clinical rotation, or day in the life of a nurse practitioner student video, guys, really soon. So go ahead and subscribe to the channel, become an NP with me. I'm just an average Jane doing my thing, and I would love to have you come along for the journey. All right, I will see you in the next video.